Hello, my name is Collette Moore, and I am a student nurse practitioner, and today I will be performing a musculoskeletal exam. Hi, how are you?
Fine.
Can I have your name?
Herman Medina,
Can I have your date of birth?
9/10/67.
Can I have your consent to do this musculoskeletal examination on you today?
Yes.
And do I also have your consent to upload it and put it on YouTube for my instructor to watch?
Yes.
Okay, good. Before we get started, I'm just going to wash my hands. Okay, first thing that we're going to do with the musculoskeletal examination is inspection of the hands. So I'm going to have you put your hands out. And I am looking at the hands. I'm looking for any joint symmetry, muscular atrophy. I'm looking for redness. I'm looking for deformities, any nodules or any swelling. And I don't see anything. So I'm going to go ahead and palpate. So I'm going to palpate the distal phalanges and the proximal phalanges. I'm going to palpate the metacarpal phalanges of the hands. Okay, I don't feel any nodules. Do you have any pain or any tenderness?
No.
Okay, good. So now we're going to do some range of motion of the hands. I'm just going to have you make a fist. Okay, good. Then I'm going to have you straighten out your hands. Then I have you open them up. That is abduction. Then I'm going to have you close them. Abduction. Then I'm going to have you flex them up. And then I'm going to have you flex them downwards. Any pain or any tenderness?
No.
Okay, good. Moving on, I'm going to move on to the wrist. I'm going to be inspecting the wrists, also looking for any joint symmetry, any muscular atrophy, any swelling, any redness, any nodules, or any abnormalities, deformities of the wrist. So I don't see any. So I'm going to go ahead and do some range of palpate the wrist. I'm going to be palpating the carpal bones and the metacarpal bones. I'm going to turn it and palpate. Any pain, any tenderness?
No.
I don't feel any nodules. So now I'm going to do some range of motion of the wrist. So I'm going to have you go ahead and flex them upwards. I'm going to have you go ahead and flex them downwards. I'm going to have you rotate them inwards. And then I'm going to have you rotate them outwards. Then maybe do some circular motions. Any pain or any tenderness?
No.
Okay, good. Now I'm going to perform some special tests. I'm going to take my hammer. And the first test I'm going to perform is called a Tunnel's test, which I'm going to take the patient's ulnar wrist, and I'm going to take my hammer and I'm going to tap down on it. Any pain or tenderness in your middle or index finger?
No.
Okay, do the same thing on the other side. Take it. Any pain, any tender in your middle or index finger?
No.
All right. If you had any pain or tenderness, then I would suspect carpal tunnel of the wrist. Okay, good. So now moving on, I'm going to do the elbows. So I am looking at the elbows. I am looking for the joint symmetry. I'm looking for making sure there's no redness, there's no swelling, there's no nodules, there's no deformities or no muscular atrophy on the elbows. Okay, I'm inspecting both of them. There's nothing abnormal about the elbows. So now I'm going to do some palpating. So I am going to be palpating for any pain or tenderness. So I'm going to palpate the ulna. Any pain, any tenderness?
No.
The olecranium, any pain, any tenderness?
No.
The medial epicondyle, any pain, any tenderness?
No.
The lateral epicondyle, any pain, any tenderness?
No.
And the medial epicondyle, any pain or any tenderness?
No.
Okay, do the same to the other side. I am going to palpate the ulna. Any pain, any tenderness?
No.
No nodules?
No.
Okay. I'm going to palpate the olecranium. Any pain, any tenderness?
No.
I don't feel any nodules. I'm going to palpate the lateral epicondyle. Any pain, any tenderness?
No.
And the medium epicondyle. Any pain, any tenderness?
No.
Now, if he had any pain or tenderness in the medium epicondyle, then I would expect baseball elbow. And if he had any pain on the lateral aspect of the epicondyle, I would expect tennis elbow. So he doesn't have any pain or tenderness. So we're going to go ahead and do some range of motion. So I'm going to have you go ahead and extend your elbows out. And then I'm going to have you flex them in. Then I'm going to have you go ahead and bend them out. I forgot. Bend them out and then bend them in. Then I'm going to have you go ahead and pull them straight out into subnate, and then I'm going to have you turn them downwards into pronate. So any pain, any tenderness?
No.
Okay, moving on. I'm going to go ahead and do the shoulders. I am looking at the shoulders. I am looking at the shoulders for any deformities. I'm looking for symmetry. I'm looking both anterior and posterior of the shoulders. I don't see any abnormal lumps, bumps, or any abnormality with the shoulders. No redness, no swelling, no deformities, no atrophies, no the joint symmetry is there, so no abnormality with the shoulders, no nodules. So I am going to now palpate the shoulders. I'm going to go ahead and start with the supraventricular acronym process. I can't get that word. The acromioclavicular process, which is over here on the nodules of the shoulders, and then I'm going to palpate the humerus tenocities, the acromion process, the what is that word? The subdeltoid processes, and the bicep groups. Any pain, any tenderness?
No.
Okay, so now I'm going to go ahead and do some range of motion of the shoulders. So I'm going to have you extend the arms up. Okay, then I'm going to have you go ahead and put them down to your side. Have you put them down to your sides and then back. Okay, any pain, any tenderness?
No.
Okay, so now I'm going to have you go ahead and reach over your shoulder behind your neck, and then I'm going to have you touch your back scapula, and then I'm going to have you do it with the other arm as well, and then your back scapula. Any pain, any tenderness?
No.
Okay, so now I'm going to perform some specialty tests. I'm going to have you stand up, and I'm going to perform what's called the empty cans test. I'm going to take your arm, and I'm going to put them out, and I'm going to have you turn it like you want to empty some cans. So go ahead and turn them in, and then I'm going to press down on it, and don't let me put them down. Okay, the strength is there. If you had any weakness, then I would suspect rotator cuff tear. Okay, go ahead and sit down. Now I am going to move on to your head and neck. I'm looking at the asymmetry of your face, and your head is normal symmetric. So now I am going to, I don't see any abnormality or deformity. So I'm going to take my 2 fingers, and I'm going to palpate the TMJ. Any pain or any tenderness?
No.
Going to have you open and close your jaw. Close it. Okay, I don't hear any abnormal clicking, so no TMJ. Now I'm going to have you open your mouth wide, and I'm going to see if you can press 3 fingers into your mouth. Okay, all right, so the patient's able to go ahead and put the 3 fingers inside the mouth. So now I'm going to be palpating your sternocleidomastoid, I am going to palpate your trapezius, and then your lumbar, and then your cervical, and then your post cervical muscles. Any pain, any tenderness?
No.
Okay, now I am going to have you do some range of motion of your neck. So I'm going to have you go ahead and bend it towards your chin. I'm going to have you go ahead and press backwards, and then I'm going to have you move to your left. Go ahead and turn your head to your left, and then your head to your right. And then I'm going to have you place your head to your right shoulder, and then place it to your left shoulder. Any pain, any tenderness?
No.
All right, so now I'm going to do a specialty test. It's called the Spurlin's test. So what I'm going to do is press your neck a little bit to the side. I'm going to press down on your head. Any pain or any tenderness?
No.
If you had pain or tenderness, then I would suspect cervical radicular cervical radicular pain. So now we're going to move on to your feet and toes. So I'm going to put the camera down towards the feet and toes. Okay. Now, for your feet, I'm going to inspect your feet, and what I'm going to be looking for, I'm going to be looking for any corns, any calluses, any warts, any moles, any bunions, or any discoloration or deformities, and I don't see any. So I'm going to go ahead and look at the other one, looking for any redness, any swelling, any corns, any warts, any bunions, any nodules or deformities. So I don't see any. So I'm going to go ahead and do some palpating. I'm going to palpate the phalanges of the toes, both distal and proximal. I am going to palpate the necromia to make sure there is no neuromia in the interdigital area. Any pain, any tenderness?
No.
Okay, and I'm going to palpate for plantar fasciitis. Any pain, any tenderness? And I'm going to palpate the Achilles in the back. Any pain or any tenderness?
No.
All right. Now I'm going to have you flex your toes upwards, and then flex your toes downwards. And I'm going to have you rotate your feet outward, and then rotate your feet inward. I'm going to do the same thing. I'm going to point the toes up, point the toes down. I'm going to rotate the foot out, and I'm going to rotate the foot in. So, and now I'm going to do some circular motion with the feet. Any pain or any tenderness?
No.
Okay, that was range of motion of the feet. So now I'm going to move on to the ankle. I'm looking at the ankles to see if there's any redness, any swelling, any discoloration, and I don't see any. So I'm going to look at the other ankle. I'm checking for redness, swelling, or discoloration. I don't see any. So now I am going to palpate. I'm going to palpate the internal and the external malleus, and I'm going to palpate the Achilles. Any pain or any tenderness?
No.
I don't feel any nodules. So I'm going to do some range of motion, and then I'm going to have him do some range of motion. I'm going to flex the ankle up. I'm going to flex the ankle down, and then I'm going to do some circular motions with the ankle. On the left, and then I'm going to do it on the right. I'm going to flex the ankle up, and then I'm going to flex the ankle down, do some circular motions. Any pain, any tenderness?
No.
All right, I'm going to have you go ahead and flex your ankle up, and then flex your ankle down, and do some circular motions. Other feet, flex your ankle up, flex your ankle down, and do some circular motions. So no pain, no tenderness on the ankles. So I'm going to go ahead and move on to the knees. I am looking at the knees. I'm checking for asymmetry. I am making sure there is no swelling, no redness, no muscular atrophy, no deformity, no abnormality and it's symmetrical on both knees. So no abnormality on the knees. I'm looking at the super patella, and I'm looking at the sides of the patella, and I'm going to feel the super patella and the sides of the patella, and I'm going to get behind the popliteal, and I'm feeling for any Baker's cysts or any fluid-filled nodules, and I don't feel any. Okay. So now I am going to move on to some range of motion of the knee. I'm going to go ahead and have you, I'm going to do it first, and then I'll have you do it. I'm going to bring the knee out, then I'm going to bring the knee in. I'm going to rotate the knee, which is going to be abduction, and then I'm going to bring it back, which is going to be abduction. I'm going to do the same on the left. I'm going to flex the knee. I'm going to bend the knee. I'm going to do some abduction and some abduction of the knee. Any pain or any tenderness?
No.
I have the patient do the same thing. Go ahead and stretch the knees out. Go ahead and stretch the knees back in. Rotate them outwards, and then go ahead and rotate them outward and then back inwards. Any pain or any tenderness? Yeah. Any pain or any tenderness of the knees?
No.
All right. So now I am going to perform some specialty tests on your knees. I'm going to do the valgus and the vargus of the knees, and I'm going to do I'll start off with those. So go ahead and lay you down. Put the camera so you can see. So the vargus, I'm going to take my hand and I'm going to put it at the outer femur and then the inner ankle. I'm going to flex it about 20 degrees, and I'm going to pull it out. Any pain or any tenderness?
No.
All right. So this one is negative, so I'm going to do the opposite. Put my hand and out, and then the ankle in. And I'm going to flex it a little bit in and out. Any pain, any tenderness at about 20 degrees?
No.
All right. So a negative on his vargus. So now I'm going to do the varus test. So it's almost the same, except I'm going to put my hand in the inner thigh and my hand on the outer ankle, and I'm going to flex it about 20 degrees. Any pain, any tenderness?
No.
All right, and then do the opposite. Inner thigh, outer ankle, 20 degrees. Any pain or any tenderness when I pull your tibia out?
No.
At about 30 degrees. No pain or no tenderness. So the next test I'm going to do is called the George test. Okay, so I'm going to have your leg, bend your knee at about 90 degrees, and I'm going to sit on the patient's foot. And I'm going to take my hand and I'm going to go ahead and press in on the knee. Any pain or any tenderness?
No.
Then I'm going to pull out. Any pain or any tenderness?
No.
All right, then I'm going to do it on the opposite leg, which is going to be your right. So I'm going to pull it out towards me. Any pain or any tenderness?
No.
Then push it in. Any pain or any tenderness?
No.
All right, so I was able to flex the patient's knee at a 90 degree, and I was able to pull it in and pull it out, forward and backwards. There was no pain or no tenderness, no crepitus. So the next test I'm going to do is called the McMurray's test. So I'm going to straighten the legs. And I'm going to take the knee and I'm going to bend it in, and I'm going to rotate the tibia. Laterally rotate the tibia. Any pain or any tenderness?
No.
All right, so I'm going to fully flex the knee. I'm going to rotate it. Any pain or any tenderness? No. Okay, if it was pain or tenderness, then I will be worried about crepitus. All right, so next thing I'm going to do is your hips. So I'm going to go ahead and have you stand up. And I'm going to be looking at your hips. I am checking for symmetry of the hips to make sure there is no swelling, that it's in line, there's no nodules or no redness on the front. And then I'm also going to look at the back. Make sure that your hips are even, no redness, no swelling, no nodules, and there's no deformities of the hips. Now I'm going to palpate I'm going to palpate the anterior ilia joints, the ACEs, superior iliac spine. Then I'm going to turn you around and I'm going to palpate your sacroiliac joints. Okay. Then I'm going to turn you a little bit and I'm going to palpate inside your sacroiliac axis area to make sure there is no pain or tenderness. Any pain or any tenderness, no lumps, no bumps. I'm going to palpate your greater trochanters also. Any pain or any tenderness. No. Okay, now I'm going to have you do some range of motion. Dan, I can't see. Okay. Do some range of motion. I'm going to have you go ahead and bend forward at the hips. Okay, and then I'm going to have you stand up and I'm going to have you sit down. I'm trying to remember what that old lady did. Go ahead and lay down on your hips. Okay, I'm going to have your leg go straight up. Okay, then I'm going to have you bend it, then extend it. Okay, and then I'm going to have you abduct it out, and then we're going to adduct it inwards. I'm going to go straight up, and then I'm going to bend your knee. Then I'm going to go abduct, and then adduct at the hips. Then I'm going to turn you around on your back, and I'm going to have you bring your leg straight up towards your hip. Okay, good. And then your leg straight up towards your hip. I'm going to have you do that yourself. Go ahead and bring. Okay, good. I'm going to turn you around and have you do those hip exercises again. Your legs straight out, legs straight up. Okay, one at a time. Straight up. Okay, straight down, straight out, and then straight in. And then this one straight up, straight down, straight out, and then straight in for abduction. Any pain or any tenderness? No. All right, now I'm going to do two tests, the Thomas and the Patrick test. So I'm going to take for Thomas, I'm going to take your knee and I'm going to bend it, and I'm going to push it in towards your abdomen, checking your lumbar spine. Any pain, any tenderness? No. Then I'm going to take your other knee, I'm going to bend it, and then press it towards your abdomen. Any pain, any tenderness? No. Okay, then that's called the Thomas test. Now I'm going to do the Patrick test. Okay, I'm going to have you take your knee and do one of them at a time. We'll bend your knee. Then I'm going to bring this knee on top of this knee. And then I'm going to press down. Any pain, any tenderness? No. All right, then we're going to do the opposite side. I'm going to have you bend this knee up. And then I'm going to take this knee and I'm going to press it over. And then I'm going to put some pressure on it. Any pain, any tenderness? No. All right, that was the Patrick test. So now I'm going to have you stand up and we're going to go ahead and do your spine. Have you stand in front of the camera. Maybe we could take your shirt off so she could see the back. Okay, come up a little closer to the camera. So, no, just stand straight. So, for the spine, I am checking the symmetry. I'm making sure I don't see any lordosis or kyphosis of the spine. Checking for the smoothness of the spine to make sure there's no lumps, nodule. So now I'm going to palpate. So I'm going to go ahead and palpate your spine. Any pain, any tenderness, starting at the cervical. Okay, no pain or tenderness. All right, so the shoulders are symmetrical. I'm going to go ahead and have him bend at the hip. So he's going at a 90 degree and he still has a smooth back. There is no scoliosis. So I'm going to have you stand up and I'm going to palpate. I'm going to take the ulna. Palpate down the spine. Okay, good. Now I'm going to have you do some range of motion. So I'm going to go ahead and have you bend forward. Okay, then I'm going to have you bend backwards. Okay, and then I'm going to have you turn your shoulders over to the right, and then turn your shoulders over to the left, and then I'm going to have you twist your shoulders, both of them. Okay, right and left. Okay, very good. And did you go backwards already? Bend backwards. Okay, good. Now I'm going to have you do a specialty test called the straight leg test. I'm going to go ahead and lay you down. And this test is me just raising your legs straight up and down. So all the way up. Okay. And then all the way down. Any pain, any tenderness?
No.
All right. So I'm going to go ahead and conclude my musculoskeletal examination. Thank you for watching.